సో పేపర్ 6 క్వశ్చన్స్ వస్తాయమ్మా మామూలుగా. సో నిన్న రేడియాలజీలో 6 క్వశ్చన్స్ ఎలా అయితే వచ్చినాయి, పాథాలజీలో కూడా మనకి ఒక 6 క్వశ్చన్స్ వస్తాయి. సో ఇలా మొత్తం పాథాలజీ వచ్చేసి 80,000 సిరీస్ ఉంటుంది. నిన్న 70,000 సిరీస్ కదా. సో పాథాలజీ వచ్చేసి 80,000 సిరీస్ ఉంటుంది. సో ఇలా మనం స్క్రోల్ చేసుకుంటే కనుక వస్తే ఇక్కడ మాలిక్యులర్ పాథాలజీ జీన్ టేబుల్ అని ఉంటుంది. సో మాలిక్యులర్ జీన్ టేబుల్, పాథాలజీ జీన్ టేబుల్ అని ఉంటది. సో దీంతో మనకు అవసరం లేదమ్మా, దీని నుంచి క్వశ్చన్స్ ఏం రావు. సో ఈ టేబుల్స్ అన్ని స్కిప్ చేసేయండి. సో ఇక్కడ నుంచి చూడండి. సో ఇన్ pathology and laboratory guidelines. So already yesterday I told you that unlisted procedures are available in the radiology. సేమ్ అలాగే pathology లో కూడా అన్లిస్టెడ్ ప్రొసీజర్ కోడ్స్ ఉంటాయి స్టార్టింగ్ లో. మనకి ఎనస్థీషియాలో కూడా అన్లిస్టెడ్ కోడ్ స్టార్టింగ్ లోనే ఉంది. రేడియాలజీలో కూడా అన్లిస్టెడ్ కోడ్స్ స్టార్టింగ్ లోనే ఉన్నాయి. పాథాలజీలో కూడా అన్లిస్టెడ్ కోడ్స్ ఇట్లా స్టార్టింగ్ లోనే ఉంటాయి, స్టార్టింగ్ చాప్టర్ లోనే ఉంటాయి. మెడిసిన్ కి కూడా అలాగే ఉంటుంది. సర్జరీకి మాత్రం అన్ని పార్ట్స్ కలిపి స్టార్టింగ్ లో ఉంటుంది. అది నేను సర్జరీ వచ్చినప్పుడు చెప్తానండి. సో ఇన్ pathology the unlisted codes are available same as like radiology. Okay, these are the unlisted codes. Most of the codes are end with the 99 only. I already told you that if radiology start with 7 and end with 99, pathology 8 series, so start with 8 and end with 99. సో ఫస్ట్ వచ్చేసి ఇన్ pathology laboratory లో 6 క్వశ్చన్స్ వస్తాయమ్మా. జస్ట్ ఇక్కడ పారాగ్రాఫ్ ఉంది కదా, ఇది చదవండి. దీస్ ప్యానల్స్ ఆర్ డెవలప్డ్ ఫర్ కోడింగ్ పర్పస్ ఓన్లీ అండ్ షుడ్ నాట్ బి interpreted as clinical parameters. The test listed with each panel identify the defined components of that panel. అంటే ఒక్కొక్క ప్యానెల్ లో డిఫరెంట్ టైప్స్ ఆఫ్ కాంపోనెంట్స్ ఉంటాయి అని చెప్తున్నాడు. దీస్ ప్యానల్ కాంపోనెంట్స్ ఆర్ నాట్ ఇంటెండెడ్ టు ద లిమిట్ టు ద పెర్ఫార్మెన్స్ ఆఫ్ అదర్ టెస్ట్. సో ఈ ప్యానెల్లో ఏదైతే కాంపోనెంట్స్ ఉంటాయో ఆ కాంపోనెంట్స్ వేరే ప్యానెల్లో ఉన్న వేరే కాంపోనెంట్స్ కి అట్లా ఏం ఎఫెక్ట్ చేయవు అని చెప్తున్నాడు. If one perform the test in the addition to those specifically indicated for particular panel, those tests should be reported separately in addition to the panel code. Suppose I will tell one example. Suppose so CBC is nothing but complete blood picture. So in this A component, B component, C component, D component, E component, G component, H component is there. Same another panel like suppose example I am writing. So RBC panel, in that same like A component, B component, G component, H component is there. So here first panel is CBC panel, second is RBC panel. So here already in CBC A test is there. This is a component. A is component. A is also is component. Here B is also component. Here B is also component. So G is also component. H is also is component. So now they will ask for CBC example like 1, 2, 3, 4, 5. RBC panel like 2, 3, 4, 5, 6. So now in the option they will give in the exam they will give what code you will assign for CBC and RBC. So options is A option is 1, 2, 3, 4, 5. B option is 2, 3, 4, 5, 6. C option 1, 2, 3, 4, 5 and 2, 3, 4, 5, 6. D option only uh, none of the above. So what is your answer here? Can you guess? Not all. So please just you can remember, Amma. So here A test is there. A test is there. So I am strike off A test here. Here also I am strike off A test. So here B test I am to strike off. Here also B test is strike off. Here G is available. So here H is available. So here G is available. So H is also available. So no need to give 2, 3, 4, 5, 6. Because you can remember one thing. One test, two tests should not repeat together. At a time, only one test we should document it. Two tests should not repeat together. If I give 1, 2, 3, 4, 5, it is more than enough. So all the tests are included in the 1, 2, 3, 4, 5, A, B, G, H, whatever the 2, 3, 4, 5, 6 tests, all included in 1, 2, 3, 4, 5. And additional CD also comes under this 1, 2, 3, 4. సో ఇలా 2, 3, 4, 5, 6 లో ఏదైతే టెస్ట్లు ఉన్నాయో అవన్నీ 1, 2, 3, 4, 5 లో ఉన్నాయి. సో నేను 1, 2, 3, 4, 5 ఇస్తే 2, 3, 4, 5, 6 కూడా ఇండైరెక్ట్ గా ఇచ్చేసినట్టే. సో సిడికి కూడా అడిషనల్ గా 1, 2, 3, 4, 5. సో నా ఆన్సర్ వచ్చేసి నౌ మై ఆన్సర్ ఈస్ 1, 2, 3, 4. నౌ ఐ కెన్ షో ద ఎగ్జాంపుల్, దెన్ ఇట్ విల్ గివ్ ద మోర్ క్లారిటీ. సో దట్స్ వై దే ఆర్ క్లియర్లీ సేయింగ్ those tests should be reported separately in addition to the panel code. Suppose previously I said one example 1, 2, 3, 4, 5, 2, 3, 4, 5, 6. In 2, 3, 4, 5, 6, I test is there. But in A, in 1, 2, 3, 4, 5, I test is not available. At that time, I have to document 1, 2, 3, 4, 5. And for I test, there is a separate code. That also we have to give along with that code. So whatever the tests are not available, the test reported separately. ఏదైతే వేరే ప్యానెల్లో టెస్ట్లు అయితే లేవో ఆ టెస్ట్ ని మనం సపరేట్ గా డాక్యుమెంట్ చేయాలి. సో విల్ గివ్ ద ఎగ్జాంపుల్. నో వరీ, డు నాట్ రిపోర్ట్ 2 or more panel code that include any of the same constituent test performed from the same patient collection. If a group of tests overlap 2 or more panels, report the panel that incorporates a greater number of tests to fulfill the code of the definition and report the remaining test using the individual test code. Do not report 80047 in conjugation with the 80053. So I will show the example now. Clearly you can see. Here, basic metabolic panel is there. Basic metabolic panel is there. Here, comprehensive metabolic panel. See carefully. Here, basic metabolic panel is there. Comprehensive metabolic panel is there. In exam, they directly asked what is the CPT code for basic metabolic panel and comprehensive metabolic panel. In first option, they give 80047. Second option, they will give 80053. Third option, they give 80047 and 53. Fourth option, they give like 80048. So now we can check. In the comprehensive metabolic panel, basic metabolic panel, carbon dioxide is there. Here also carbon dioxide is there. Okay. Here chloride is there. Here also chloride is there. Here creatine is there. Here also creatine is there. Here glucose is available. Here also glucose is available. Here potassium is there. Here also potassium is there. Okay. Here sodium is there. Here also sodium is there. Here urea and nitrogen are available. Here also urea and nitrogen are available. But calcium ionized here is there. Calcium ionizing.
Calcium total.
But calcium total is there. Calcium ionizing not available. Just a minute, I will erase that one. Okay. So now my answer is they will give in the documentation like this.
80053.
80053 80047 80053 and 80047 and 80053 and 82330. Now which is your answer?
8005.
53 and
Ah,
82330 also we have to, because whatever the tests are available in 80047, all tests are is there in the comprehensive metabolic panel except calcium magnesium. So my answer is D, 80053. If I give means from here to here, all tests are available comprehensive metabolic panel. So that I given 80053. But only calcium ionizer is not available in the comprehensive metabolic panel. For that only, I am additionally documented 82330. So I will show one more example. Then it will give more clarity. If you coming down, now I am speaking about basic metabolic panel calcium total. Basic metabolic panel calcium total. So calcium total, carbon dioxide, chloride, creatine, glucose, potassium, sodium, urea, nitrogen. Everything is there. Calcium total, carbon dioxide, chloride, creatine, glucose, potassium, sodium, urea, nitrogen. Whatever the tests are available in basic metabolic panel of calcium total, every test star is available in the comprehensive metabolic panel. But in this case, our answer is different. What is that? So only 80053 is enough. There is no additional test along with the 80053 to document in the 80048. Only 80053 is enough. So I will show one more example. So just we have to cross check with the test whether the tests are matching in the same panels or not. If other than the test, any additional test is there, we have to document as separately. So now you can see general health panel is given, comprehensive metabolic panel is also given. Then I need to code only general health panel. Why means in general health panel, this panel must include the following comprehensive metabolic panel. They are clearly saying in general health panel, the comprehensive metabolic panel is included. Then no need to code for comprehensive metabolic panel. Just you can report the 80050. That's enough. I will show one more example. Suppose lipid panel they given, renal functional panel they given. Lipid, definitely one question will come in the CPC exam from this panel. So you have to observe carefully, okay? Lipid panel, renal functional panel they given. In lipid panel, cholesterol, serum, lipoprotein, triglycerides. Renal functional panel, albumin, calcium, carbon dioxide, chloride, creatine, glucose, phosphorus, potassium, sodium, and urea. So in lipid panel, tests are different and renal function tests are different. Now our answer is both. We have to report 80061 and 69. Because why he directly asked that what is the CPT code for lipid and renal functional panel? At that time, we have to report both the codes because there is no test are overlapping each other in the different panels. So then we need to code both the CPT. In previously, some tests are overlapping with other panels. That's why we are not reporting direct panel code. If only additional test is there, we have to report one panel with the additional test only. We are documenting actually. Okay. So now one more question. Same renal functional panel they given, except creatine they asked. Except creatine they asked. Directly in the exam they asked renal functional panel except creatine. Then what is your answer? Renal functional panel except creatine. What is your answer then?
ఇది ఈకోటి
అది ఇస్తే క్రియాటిన్ వస్తుంది. If you give 80069, the creatine is including, right? So what I am telling, except creatine. Then what is your answer means? No, no, no. We have to give all the codes: albumin, calcium total, carbon dioxide, chloride. Don't give creatine. Glucose, phosphorus, inorganic, potassium, sodium, urea nitrate. Except creatine and 80069, we have to document remaining all the CPT codes, because they are clearly saying in renal functional panel except creatine. If you give 80069, creatine is included. So to exit the creatine, we have to accept creatine, remaining all CPT, we have to assign. Okay, that is one type of scenario they will ask. In the CPC, most of the time they asked the question from here, obstetric panel. Obstetric panel, recently they asked the question. So what they asked means, obstetric panel, antibody, syphilis, non-treponal antibody is there, syphilis treponal is there. See, for syphilis non-treponal antibody, the code is 86592. When syphilis screening is performed using treponal, in the bracket you can observe. In the bracket you can observe, when syphilis screening performed using treponal antibody, approach 86780. Lot of time they given, what they done, you know. So they mentioned all the tests in the obstetric panel. You should not report 80081. In the place of all the tests they given, in the place of non-treponal, they given treponal. So for treponal, you should not use a 80081. If any option with 80081, you can eliminate that option. Obstetric panel, definitely they will ask the treponal. I will show you the question if it is available. Just a minute. చూడండమ్మా, treponal. See, a physician order obstetric panel that include the syphilis screening using non-treponal antibody approach, an automated CBC with a manual differential WBC, serum antibody, all these things they given. Non-treponal ఇచ్చాడు, treponal ఇలా. సో ఇక్కడ చూడండి, ఫస్ట్ వచ్చేసి నాన్ ట్రెపోనల్ యాంటీబాడీ అప్రోచ్. వాట్ ఈస్ యువర్ ఆన్సర్? 8659 నాన్ ట్రెపోనల్. 86592. Which option is having 86592? 8659. 86590 ఉందా? 86762 ఉందా? 86790 780. ఓకే చెప్పండి. సో నాన్ ట్రిప్ అనాలమ్మా. 80055 ఎక్కడ ఉంది చూడండి. లేదా దీంట్లో
స్టార్టింగ్ 85 తో స్టార్ట్ అయింది.
85027 ఉందా? ఎస్. సిబిసి 85027, 85007 డబ్ల్యూబిసి, 87340 యాంటీబాడీ, 86762 యాంటీబాడీ రూబెల్లా, 86780 that is treponal. 86780, 86850, 86900 blood typing ABO, 8690.
టైపింగ్ ఆర్ఎన్.
80055 it is not available here, right? So you can eliminate the first option, amma. So here option is D option. Actually that is not treponal. It is a like treponal. It's given like wrong. So we have to select like that actually. If we give 80055, where it is available 80055, I will check.
ఆప్స్టిక్ ప్యానల్.
Okay, this is the thing, optic panel. So we should not give the 80055 because only some tests are only documented in the optic panel. So we should not give 80055. In which option the 800 is available, you can eliminate that one. So B option also you can eliminate. 80081 also you can eliminate because
ఆప్స్టిక్ ప్యానల్ హెచ్ఐవి టెస్ట్.
include HIV testing, but this is only speaking about the optic panel. So they are not saying here optic panel for HIV testing, right? So no need to give the 800.
8
Don't give the 80081 also. సో ఇలా చాలా జాగ్రత్తగా చేయాలమ్మా ఆన్సర్, ఓకేనా? సో యూ హ్యావ్ టు రిమెంబర్, డోంట్ గివ్ ద 80055 because optic panel only some tests are documented. For the test only we have to give the code. ఓకేనా? ఇది ఒక్కటి చూసుకోండి చాలు. సో లైక్ దట్ దే విల్ కన్ఫ్యూజ్. సో ఇలా అడుగుతారు, కొంచెం జాగ్రత్త చూసుకున్నామా. డెఫినెట్లీ వన్ క్వశ్చన్ విల్ కమ్ ఫ్రమ్ ద ప్యానల్స్, ఓకే? ఆర్ సమ్ టైమ్స్ ఇట్ దే మే ఆస్క్ 2 questions ఆల్సో, but definitely one question they will give 100%. If any set, if you can observe, so all the test is having the one panel question, okay? After that, you can directly come to the presumptive drug class screening. From here, lot of time they will ask you the question 80305, 306 and 307. 80305, 306, and 307. If you observe 80305, it is clearly saying direct optical observation only. Direct optical observation only. 80306, instrument assisted direct optical observation. Previously, there is no word for instrument, but here clearly the document is the instrument assisted direct optical observation. In the CPC exam, how they will do means, so the patient came to the hospital, they are doing the urine analysis with the naked eye. So directly they are visualizing the that urine sample. So at that time we can give like 80305. Sometimes that urine sample they collected, some instruments are used to perform the test. Like that they will give. At that time you can use the 80306. Coming to the 80307, by instrument chemistry analyzers, some chemicals they used to detect the test, like chromatography, non-chromatography. Already chromatography, the people who study like pharmacy and biochemistry, they know regarding that. Regarding they know what is chromatography and non-chromatography. For that, we have to give the 80307. In the CPC exam, lot of time they asked without chromatography. What is your answer? 80307 only. Because they are clearly given with or without chromatography. Or sometimes they will give for without non-chromatography techniques. So definitely we have to report 80307. Definitely one question will come from these three reports. Okay. Next we can go with the definitive drug testing. If you observe definitive drug testing, 80321, alcohol biomarkers 1 or 2, 3 or more, alkaloids, amphetamines 1 or 2, 3 or 4, 5 or more, something they are giving. But in the CPC exam, they won't tell directly amphetamines 1, 2, 3, 4 like that. They won't give. Just they will mention drug names. We have to check under which classification these are available. So how many drugs they given? So based upon that only, we have to assign the code. అంటే యాక్చువల్గా ఏంటంటే అమ్మా డైరెక్ట్ గా మీకు యాంఫిటమైన్స్ అని 1 or 2 అని చెప్పి చెప్పరు. కొన్ని డ్రగ్స్ ఇస్తారు, కొన్ని డ్రగ్స్ పేర్లు ఇస్తారు. ఆ డ్రగ్స్ ఏ క్లాసిఫికేషన్స్ కింద ఉన్నాయో చెక్ చేసుకొని ఎన్ని ఇచ్చాడో చెక్ చేసుకొని దానికి ఆన్సర్ ఇవ్వాలి. సో అది ఎక్కడ చెక్ చేస్తాం? వీఆర్ హ్యావింగ్ వన్ టేబుల్. ఇఫ్ యు ఆర్ కమింగ్ డౌన్, వీఆర్ హ్యావింగ్ వన్ టేబుల్ ఇస్ దేర్. In this table, clearly documented. For alcohols, we have to give 80320. For alcohol biomarkers, 321, 322. For alkaloids, 323. For amphetamines, 324, 325, and 326. So how they will ask the question? In the CPC exam, directly they will give the drug names. Amphetamine, ephedrine, methamphetamine, phentermine. So 4 drugs given. So these drugs are under the amphetamines. For amphetamines, what codes we have to report? 80324 and 326. Now I can go to the 80324. Total how many drugs? 4 drugs. 80324, 326. See, what is your answer now?
3 or 4.
4 drugs they mentioned, right?
3 to
4
5.
drugs they mentioned. So that's why my answer is 80325. So one more example I can say you. So if you are coming to the table, they given okay, they given antileptic drugs, epileptic, carbamazepine, clobazam, dimethadone, ethoxamide, azovir. 1, 2, 3, 4, 5. 1 to 5 drugs they given. Then what we have to do? We have to come to the 80339. now. 80339.
ఇందులో 1 to 3 అనే ఉంది. Otherwise
339. Amphetamines 1 to 3. If you are coming down, 80340, 4 to 6. So I already mentioned 5 drugs, right? So our answer is 80340. Like that we have to answer, Amma. Directly they won't give amphetamine, antidepressant, whatever it may be. Just they will give the drugs names. We have to check whether the drugs are under which classification. సో ఇంకొక లాజిక్ ఏంటంటే డైరెక్ట్ గా ఇప్పుడు డ్రగ్స్ నేమ్ ఇచ్చారనుకోండి, అవన్నీ ఎత్తుక్కోవాలంటే కష్టం కదా జనరల్ గా. సో ఆల్రెడీ దే విల్ గివ్ ద ఆప్షన్ సంథింగ్ 80339 or 340, some options they will give. Then you can directly go to this table and where that codes are available you can check. Suppose they give 80332, whatever the drugs are documented, whether it is available here or not, then it will be easy to find. Because if you want to search for drugs, if you keep on searching all these drugs, the time will be gone. So no need to, just you can see the option whenever you see the drug names, and you can see the option, what are the options they given. Based upon that option, you can check whether the drug names are available or not in that list. So based upon that, you can finalize your answer. Then it will be easy. ఓకే, అది చాలా సింపుల్ అమ్మా. ఇంక ఈ డ్రగ్స్ నేమో మొత్తం చదువుకుంటూ వస్తే మీకు 5 నిమిషాలు 10 నిమిషాలు ఇక్కడే అయిపోయింది టైం. సో ఆప్షన్ చెక్ చేసుకొని, ఆప్షన్ ఎదురుగా ఆ డ్రగ్స్ ఏమేమి ఉన్నాయి, ఆ డ్రగ్స్ క్వశ్చన్ లో ఉన్నాయా లేదా చెక్ చేసుకొని డైరెక్ట్ గా ఆన్సర్ చేయాలి. ఓకేనా? సో డెఫినెట్లీ వన్ క్వశ్చన్ విల్ కమ్ ఇన్ ద సిపిసి ఎగ్జామ్ ఫ్రమ్ హియర్. ఓకే, నెక్స్ట్ very important, amma, evacuative suppression testing. Definitely one question will come in the CPC exam from here. Evacuative, ఏ పేపర్ అయినా తీసుకోండి, డెఫినెట్ ఒక క్వశ్చన్ ఉంటుంది ఇక్కడ నుంచి. ఓకేనా? ప్యానల్స్ నుంచి ఒక క్వశ్చన్ ఉంటుంది, ప్రెజెంటివ్ డ్రగ్ నుంచి 803053 306 307 నుంచి ఒక క్వశ్చన్ ఉంటుంది. అండ్ ఆఫ్టర్ దట్ ఎవాక్యుయేటివ్ సపరేషన్ టెస్టింగ్, డెఫినెట్లీ వన్ క్వశ్చన్ ఈస్ అవైలబుల్ ఇన్ ద సిపిసి ఎగ్జామ్. So here there will be a small trick. ACTH stimulation panel they given. For ACTH stimulation panel, what is your code? 80400. In that, this panel must include the following: cortisol 2 times. In ACTH stimulation panel, the cortisol included 2 times. Cortisol is included 2 times. It means if you give 800, the cortisol is 2 times included. Now in the exam, how they will ask the question means, ACTH stimulation panel, cortisol 10 times they are given. Then what is your answer? I can write here. You can try to answer that. 80400, 8082 533 into 10, 80400, 82533 into 8, 82533 into 10, 80400. So you can try to find your answer A, B, C, D. Option C is right. Remaining people, are you agree with the option C, everyone? Okay, how they documented, I will explain you. Okay, if you are giving 80400, na, already 2 times included. So what I am saying, cortisol is 10 times. Then already 2 times included, right? So remaining 8 times not included. For that only we have to separately give the cortisol with the 8 times. If they given 20 times, Then 80400 82533 into 8. If they given 5 times 80400 82533 into 3. Like that we have to answer. It's very, very important. Definitely one question will come from this scenario. Most of the time where they ask, I will show you the question. Glucose tolerance panel they given. Lot of time they ask the same question. See, glucagon tolerance panel they given glucose 4 times and insulin 5 times they given. Then my answer is 80422 82947 83525 into 2. 5 times, right? Insulin 5 times. So this is my answer. So glucagon tolerance panel, glucose 4 times they asked, insulin 5 times they asked. So 80422 and 82947 and 83525 into 2. This is my answer. So very, very important, Amma. And sometimes they asked the question from human growth hormone panel. See, here they given growth hormone suppression panel 80430. Here glucose 5 times they given and human growth hormone also they given 5 times. At that time 80430 82947 into 2 83003 into 1. 5 times they given. Definitely one question will come from here. Next, you can directly come to the urine analysis. Urine analysis. 81. Yes, 81000. Okay. So lot of time they asked the question from the urine analysis. 81000 na non-automated with microscopy. 81001 na automated with microscopy. 81002 non-automated without microscopy. 81003 automated without microscopy. So here we have to check carefully whether it is an automated or non-automated, whether it is an with microscopy or without microscopy. So based upon that, we have to select our answer. Lot of time they will ask you the question in the CPC exam from the urine analysis scenario. Okay. So it's a direct question only. We have to, when you are going to read, we have to read thoroughly and carefully, then only you will get the correct answer. So most of the people, they are doing mistake in this simple questions. So these are no need, Amma. From here, there is no question will come. So you keep on turn up the page. Put on. Then heading just out. What's my ఇక్కడ నుంచి ఎక్కడి నుంచి రావమ్మా క్వశ్చన్స్ సో ఎక్కడి నుంచి వస్తే అది చూద్దాం ట్రాన్స్ఫ్యూజన్ మెడిసిన్ Okay. And cytopathology. Post-mortem examination. From there, definitely one question will come. Double eight, triple zero, you can come. So definitely one question will come in the CPC exam from post-mortem examination. So the series of codes are double eight, triple zero. Necropsy, gross examination only, without CNS, with brain and spinal cord, infant with brain, still or newborn with brain, macerated stillborn. Same if you observe 88020, it is gross and microscopic without CNS. With brain and spinal cord, infant with brain, stillborn or newborn with brain. Okay. So here we have to check carefully whether they are asking with gross or gross and microscopic. Whenever they are asking regarding gross with the brain, they will give the codes 88005 and 88025 also in the option. So we have to check, we have to read the question carefully whether it is a gross or gross and microscopic. If it is gross, we have to give this CPT. If it is gross and microscopic, we have to assign this CPT. Very, very important. But here also the people so mostly they've done wrong. Okay. You have to check carefully. Okay. Next question will come from cytopathology. In cytopathology, 88104, 108, 112. These three codes are very, very important, Amma. For 104, directly they will tell like smears, washing, brushing, something they will say. That is 104. For 108, we have to, they will tell like, I will show you just a minute. For 108, they will ask like centrifuge or site of spin, something they will give. Site of spin or centrifuge technique. This they will give. Site of spin, just you can write. Site of spin for 88108. Okay, that's it. Centrifuge, site of spin they will give. For 8812, they will give thin prep, liquid based slide preparation. Liquid based slide preparation. Like this, they will give thin prep you can write because here that is not available actually. Thin prep they will give. Okay. So you have to give the 8811. You can come down. Chromosome analysis. Question is chromosome analysis. Direct so 88261 you can open. 88261. 88261 is there. Chromosome analysis, count 5 cells, 1 karyotype with banding. 8826, 15 to 20 cells, 2 karyotype with banding. Count 45 cells, something they are giving. If chromosome analysis, 5 cells, 1 karyotype, na 88261. Suppose they documented chromosome analysis, 10 cells. Then what is your answer means? Along with the 88261, we have to assign for additional cells 88285. 88261 plus 88285 we have to give. No need to give into 5 into 6 something, because after 5 it may be 10 or 12, it may be 6 or 7, whatever it may be. You can directly give the single code for additional cells counted, that is 88285 along with the 88261. Same scenario, in place of one karyotype, 5 cells, they given 2 karyotype. Then what you will do? For additional karyotype, there will be one code is there, 88280. That we have to give. 88261 and 88280 we have to assign. So definitely the question will come from panels and drug testing, evacuate suppression testing, and after that post-mortem examination and cytopathology, and then chromosome analysis. Now we are entering into the surgical pathology. Definitely the question will come from the surgical pathology. It is mandatory. Every question paper they will give from surgical pathology questions. If you observe 88300, gross examination only. If you observe 302, gross and microscopy. If you observe 304, gross and microscopy. If you observe 305, gross and microscopic. If you observe 307, gross and microscopic. If you observe 309, gross and microscopic. Here total 88300 only for gross, 302, 304, 305, 307, 309. These 5 codes are for gross and microscopic examination. How they will give the question means, I will tell you very simple. So if you observe in 88302, fallopian tube sterilization is there. Finger toes amputation traumatic is there. If they give non-traumatic, then what is your answer means? If you go to the 304, A, B, C, D, E, F, fingers are not available. You can go to the 305. Fingers non-traumatic is there or not? Check. Yes, available. So just we have to check the differentiation. Whatever the words are documented, that word is available in the 80, 302, 304, 305, where it is available. Suppose they given lung biopsy. You can check in the 305 lung biopsy is available or not. IJKL. Larynx biopsy is there, lipo biopsy is there, lung trans bronchial biopsy is there. But direct lung biopsy is available or not available. In 307, you check direct lung biopsy is available or not. Lung wedge biopsy. That only we have to give answer 80307. In 309, lung biopsy is there. Yes, only resection is there. Lung resection is there. So these are the differentiation you have to check. Whether saying lung wedge biopsy or another biopsy, resection. So most of the time in the CPC exam, they asked the question is, come to the 307. You can come to the uterus. 307 uterus. Uterus with or without tubes or ovaries other than neoplastic. How they asked the question means, a female patient is came to the hospital for removal of tube and ovary. Removal of tube and ovary. Finally, they found it is non-cancerous. They given 88305. 88307, 88309, 88302. Like that they will give. So 88305, 307, 309, 302. So what is your answer? 307. If you go to the 309, it will say like a neoplastic. So just the differentiation we have to observe in the surgical pathology cases. Definitely one question will come, Amma. Next question I will tell, you can try to answer what is your answer. Polyp removal or polyp biopsy you can check. Polyp biopsy. Colon polyp. Colon polyp biopsy you can check. What is your answer? Colon biopsy 305 is there. Mostly for biopsy 88305, Amma. Remember. Mostly for biopsy 305. That's it. Next question is decalcification. Lot of time they will ask. Decalcification only we have to report single code 88311. Okay. They documented 5 times, 10 times, whatever it may be. Just you can report 88311. That's it. Don't do into 1, into 2, into 3, into 4 like that. Okay. Next one. So and also they asked sometimes group 2 stains. Here two available, Amma, group 1 and group 2. Group 1 stains for non-microorganism. Group 2 is for microorganism there is. For group 2 is 88313 and 88312. Okay, okay. 231. Okay, yes. 313 and 88312. In the exam, lot of time they will ask it iron and trichome. It is available for 313. So these are two, right? 88313 into 2 we have to. And also they given any organism. Like that question I will show you, then you will get the clarity. For that 88312 you have to give. Just a bit, I will show you that question. See, here clearly they given pathology received needle core biopsy fragment ranging the specimen entirely cassette the pathology. So received needle biopsy fragment. So 307 you can observe. Lymphobiopsy. ఇక్కడ ఉంది something the word is missed, I think here. Needle core biopsy where they will perform. I will check in the book. Best answer.
Breast, liver, lungs, kidney,
ఏందమ్మా
prostate.
లివరా?
బ్రెస్ట్ కి, లివర్ కి, లంగ్స్ కి, కిడ్నీ కి, ప్రోస్టేట్ కి, థైరాయిడ్ కి,
ఓకే ఓకే.
బోన్ ఆర్ సాఫ్ట్
లివర్.
టిష్యూ.
ఓకే ఓకే. లివర్ బయాప్సీ ఉంటుంది చూడండి అమ్మా, నీడీలు అని చాలా క్లియర్ గా ఉంటుంది. Liver biopsy, they clearly documented like needle biopsy something, right? So for that we documented 88307, and after that I already told you, right, trichome and iron. For that they given like 88313 into 2, and iron stain and positive microorganism stain something they given. So for non-microorganisms, PASD they taken like 88312. Like this they will give the answer. Okay. సో కొంచెం జాగ్రత్తగా అబ్జర్వ్ చేస్తే అయిపోయింది. మళ్ళీ 88319 మారిపోయింది. అది ఎంజైమ్ రిలేటెడ్, బట్ హియర్ దే నాట్ మెన్షన్ ఎనీ ఎంజైమ్ రిలేటెడ్ సంథింగ్. సో దిస్ ఈస్ అవర్ ఆన్సర్ యాక్చువల్లీ. సో వీ కెన్ సీ లైక్ వన్ మోర్ క్వశ్చన్. Okay, this you can leave, Amma. One more question is there. I will show you that one. 88331332 చాలా ఇంపార్టెంట్. సో దిస్ క్వశ్చన్ ఈస్ వెరీ వెరీ ఇంపార్టెంట్ అమ్మా. Just I will explain you here. So one specimen with 5 tissue block, 15 frozen sections. Second specimen with 4 tissue block, 20 frozen sections. So for this specimen tissue block and frozen section related, we have to give 88331 and 88332. 2 minutes. సో ఇక్కడ ఏంటంటే లైక్ ఫ్రోజన్ సెక్షన్ తో మనకు పని లేదమ్మా. ఓకే. సో ఎయిదర్ ఇట్ మే బి 15, 10, 20, 50. No need to count the frozen section. Only we have to calculate how many specimens, how many tissue blocks. That's it. So now my answer is 2 specimens, right? So for that, 88331 into 2. For every specimen, one tissue block is included. So if it is given 3 specimen, then into 3. If it is given 4 specimen, then into 4. If it is given 5 specimen, then it is 5. So here 2 specimen is documented. I have to write 88331 into 2. Every specimen, one tissue block is included. So final answer is 88332. In 5, one tissue block is gone. In 4, one tissue block is gone. Then 4, 3. How many? 7. So into 7. This is my answer. So I will show the one question in the CPC exam. Recently they asked it. So if it is like 4 and 2, then my answer is 88331 into 2 and 8833 into 4. Like this we have to answer. I will show the recently got the CPC exam. Question is there. I will show you that one. Then you will get the idea. See. Here what they are saying. Specimen first. First tissue block, 3 frozen section. No need to count frozen section. Second tissue block, 1 frozen section. See, it means in specimen 2 tissue block is available. In specimen 2, frozen section don't count. First tissue block is there, second tissue block is there. It means specimen 1, 2 tissue block is there. In specimen 2, 2 tissue block is there. So 2 specimens, right? 88331 into 2. So one tissue block gone means 1 more is there. Then 88332 into. Same question asked many times. Please remember, okay. Sometimes they may change. In addition to the second tissue block, they add third tissue block. Then our answer will change into 3. Okay. So concept అర్థమైతే క్వశ్చన్ ఆన్సర్ చేయడం ఈజీ అమ్మా. కాన్సెప్ట్ అర్థం అవ్వనప్పుడే కష్టం. ఫ్రోజన్ సెక్షన్ తో మనకు పని లేదు ఇక్కడ. నో నీడ్ టు రిమెంబర్ ద ఫ్రోజన్ సెక్షన్. జస్ట్ యూ కెన్ చెక్ how many specimen, how many tissue block. Every specimen is including 1 tissue block. That point you can remember, okay? After that, IHC stain they will give IHC stain. For IHC stain 88342, for 1 stain, additional stain 3 for 1. But never ask, just you can remember better. Sometimes in the documentation they directly give like IHC stain. IHC stain. So 4 they give it. Then 88342 and 88341 into IHC stain 4 they will give. If they will 5, 342, 341 into 4. So never given, but just you can remember. This is also an important concept. That's it about the pathology. Then remaining no need. Tomorrow we can go with the medicine chapter. So totally we studied regarding today. First panel, drug testing related, evacuative suppression testing, then postmortem examination, then chromosome analysis, cytopathology, chromosome analysis, surgical pathology, and tissue block concept, and microorganism, non-microorganism, some different question is available. So that's it. From here only the 6 question will come in the CPC exam. Okay, it's a very simple chapter on it, but just see how to apply some tricks. Here only 2 modifiers will come, In how the in radiology 26 modifier you kept? In only in radiology in pathology 90 and 91 modifier is available. So 90 modifier is nothing but I will show you. Appendix A is having modifiers. Please remember. Okay. Appendix A is having more modifiers 90 and 91. C 91 is repeat clinical diagnostic laboratory test. Suppose the diabetic patient came to the hospital, he done the test in the morning, again he is doing the test in the afternoon. So for same test repeating twice or thrice, then we have to give the 91 modifier. If any test is repeating twice or thrice, we have to give the 91 modifier. 90 modifier when we have to assign means sometimes to perform that laboratory test, there is no instrumentation. So they are referring outside of the laboratory. In the hospital premises, to test the test, there is no instrumentation, whatever it may be. So just they are referring to the outside of the laboratory. Then we have to give the 90 modifier. Here that is not available, but it will be there. So just 90 is outside of the laboratory. 91 is the repeated laboratory test. Like that you can write. Only two modifiers will come in the pathology. No other modifier will come. And also sometimes QW modifier will come in the pathology. QW. QW is nothing but CLV. Cleve. Something they will mention. For that only QW modifier you have to say. I will check whether it is available or not here. QW modifier will come. QW modifier వస్తుందమ్మా ఇక్కడ జనరల్ గా క్లీవా అని ఉంటది క్లీవా ఈఎం QW ఎంత కనబడట్లా సో ఓకే ఎనీవే జస్ట్ యూ కెన్ రైట్ ఓకే I will send you the tips and the questions you can practice. Okay, tomorrow I can go with the medicine chapter. Okay, that's it from today. We can continue tomorrow.